What is ICSI? ICSI is a specialized form of IVF treatment, in fact a higher grade form of IVF treatment. What we basically do in ICSI is that from your semen sample we collect normal sperms, and this normal sperm is injected into an egg to make an embryo, and this embryo is again transferred back into a uterus. So this is a stepwise process, and not every patient requires this. Your doctor will actually discuss with you whether you actually need this treatment or not. So basically this treatment is generally offered for patients for males who do not have good quality sperms or is having abnormal sperm count, or it is otherwise given as a treatment option for couples who are of advanced age, or as an option for couples who have undergone multiple IUI treatment failure or other ovulation induction treatment failure. So it is also offered for tubal block and for unexplained infertility. So this is a stepwise process, and the first step is stimulation. Normally the eggs develop in the ovaries, and then so we give injections to hasten or assist in the development of these eggs. Generally these injections are started on day 2 or day 3 of the cycle. So we ask the patients to come on day 2 or day 3, ask them to do few blood tests and a scan. So whether we are going to start the injections on that day or not depends upon the results of this blood test and the scan. So if the conditions are ideal, we would start you on injections, and your doctor will explain to you when you have to come next for the follow-up scan and the blood test. So what we generally advise is to come after 3 to 4 days of injections, and then again on that day you will be having a blood test and scan to assess the growth of the follicle. You will be given final injection when the follicles are of 18 to 20 millimeter size. Generally we advise our patients to get admitted on the final day of injection, because the final day's injection to get the full maturation is normally given in the midnight, and this is followed by few blood tests. So we ask them to get admitted on the final day of injection. The next step, which is egg collection, is done 34 to 36 hours time gap after the injection, after the final injection. So what happens in egg collection is, with the help of an ultrasound, that is scan machine, and a needle, we collect the eggs from the ovaries. We offer complete pain relief for the patients prior to that, so you don't have to worry about it. So once the egg is collected, we as I mentioned earlier, from your semen sample, normal and good quality sperms are collected, and then they are injected into this egg to make an embryo, and then the thus formed embryo is put in an incubator. Hereafter, this embryo growth is assessed and monitored each day to know the quality of the embryos, and the same will be conveyed to you. So the next step is embryo transfer. So we have two types of embryo transfer here. So one is fresh embryo transfer and the other one is frozen embryo transfer. Both the steps have got its own advantages and disadvantages. The doctor will discuss with you which option would be better for you. So what basically happens in fresh embryo transfer is, around 3 to 4 days after egg collection, we transfer the embryos back into a uterus. This is called as fresh embryo transfer. While in frozen embryo transfer, the embryos which are formed are frozen and is transferred back into the uterus around 1.5 months later, once the female's body comes back to normal from the high hormone levels. So overall the entire procedure takes around 12 to 15 days. Another fact which I want to highlight to you is regarding the specialized treatment program which we have it here for couples who had multiple IVF failures. These include specialized injections like immuno-injections like HLT, then we have PGT, ERGA and all, which again the doctor will discuss with you.
Craft Fertility Center, caring couples.